everyone, welcome back to my series. I remain your host. I hope you're having a wonderful week. So today I'll be talking on an interesting topic, which is bones. What do I mean by bones? In a simple explanation, it's injury to the skin and its underlying structures like the fat, the muscle, can go deep as the nerves and the bones. Yes. There are things that can cause burns. One of those include chemical agents, heat, either cold, liquid, or flames, um, cold, radiation, electric, friction can cause burns. Based on classification of burns, can be classified based on the depth and how, that is how deep it is, and also the size, like how what parts of the body the bone the is the patient having the burns. That is how the extent of the burns, like the surface area that the patient is having the burns, and also the body parts that is being affected. And for the depth, that's how deep is the burns, can be superficial, that's affecting the surface skin, that's the epidermis, can be partial, and also can be deep burns. So what do you do when an individual gets burnt by any of those agents I listed above? What you're going to do, first of all, you are going to take the patient away from the irritant that was the cause of the burns. If it is close to the heat, you take the patient away from it. If it's close to radiation, take the patient away from the source of the burns. Please, when an individual has burns, that's not the time to start rubbing different type of medications that a neighbor has prescribed to you that worked for him or her on the patient. Firstly, you wrap disconnect the patient from the irritant. Then you wrap the patient with the affected parts with a clean cloth, and then you take the patient to the hospital, particularly in a patient that has inhalational component, that is the patient inhaled the agent or smoke. Yes. This condition is preventable, particularly in children. Avoid leaving children to stay in the kitchen alone, and whenever you're not using your stove or your gas, you turn it off. What are the things that can happen in a poorly treated burns patient? They include infection of the infected parts, that's the part of the body that is being affected, chronic wound, that's the wound is not healing, can progress to cancer, and contracture, that's without physiotherapy, then that body part will be stiff, and a person will not be able to use it to carry out its normal function like how it normally does before. So burns is preventable if you stay away from irritants like those causative agents I listed above, and then keep children away from flammables. And if you must use those agents, ensure you use your safety kit. I would like you to this I will stop for now. So I would like you to like this video. You can share to your friends and loved ones, and you can comment. You can ask any question you have. You can just drop it at the comment section. So bye for now. See you next time.